here with registerednursern.com, and in this video I'm going to talk about the full moon phenomenon in the healthcare setting. If you have ever spoke with a nurse or a doctor who works in like a hospital, the vast majority of them will tell you that they absolutely hate working during a full moon. And the reason why is because patients and coworkers tend to act a little bit more crazy than normal. So in this video, I'm going to talk to you about what the research studies show about this phenomenon and give you my take on what I think about it. And after all that, you can just be the judge for yourself and decide if the full moon phenomenon is real or not. So first, let's talk about what the studies say about it. Has this been studied? And if so, what are they saying? Well, there's some conflicting stuff. One study done by a man named Robert Todd Carroll, he reported in his article called Full Moon and Lunar Effects that there was absolutely no effect on human behavior during a lunar full moon. But on the contrary, you have Alan M. Beck, who is from Purdue University. He did a study on Alzheimer's patients. So his specific population that he studied were patients who had Alzheimer's disease. And he found that during a full moon, there was a significant increase in behaviors such as wandering, aggression, things like that during a full moon. So from my take, I want to share my experience with you on what I've experienced during full moons. And I am an absolute believer in them. Let me share an experience with you. A couple years back, there was one of the first supermoons that was happening. And I had worked about 2 or 3 days in a row and everything was fine. And I had 5 patients, and pretty much all my 5 patients, they had a history of mild Alzheimer's, meaning that they were alert and oriented, and they could function, but they did have a history of it. But here comes the supermoon. I think it was my 3rd day. And it's about the 5 o'clock hour, 6 o'clock hour. I'm working day shift. And all of a sudden I notice a real big decline in all 5 of my patients. They start wandering, they start becoming aggressive, they're asking for people who have already passed away, they're getting super confused, getting out of the bed, trying to leave the room. And I've had to get the nursing assistants, other nurses to just help me watch my patients so they don't get up and fall and hurt themselves. So I was like, what is going on? And I remember another nurse saying, oh, it's the supermoon. And right then and there, I believed, wow, the supermoons and these full moons have to have an effect. And then later on, I started paying attention whenever these full moons started happening. And I noticed that on my unit, we would start getting a lot more admissions of patients who were had suicide attempts, drug overdoses. We would get, you would hear more code blues on the intercom overhead. Usually you hear about 1 or 2 code blues a day. You could hear up to 5 or 6. Also, I would hear more whenever in labor and delivery, when babies were being born, they would play a little lullaby over comm. And during full moons, you would start hearing that a lot more. And I've talked with some labor and delivery nurses, and they say that yes, during full moons, they have a lot more admissions of women having babies. So I have definitely noticed that. And another thing I noticed is during full moons, our ER admissions, they would be really backed up, about 4 to 5 hours, and the census in the hospital would be high. And plus I would notice that my coworkers would be a little bit grouchy. So I am totally a full believer in the full moon. And if you talk with vast majority of nurses, they will agree. One story I had heard, which is very interesting, I think that may prove it a little bit. Maybe they need to research a little bit more. But this woman, she had a daughter and she would track every time her daughter would have grand mal seizures, because that's the type of seizures that her daughter would have. And she noticed that all the time during whenever a full moon was coming up, that the seizures would start getting worse and they would become more frequent. Well, she brought it up to her family practitioner, who just brushed it off. She was like, no, that's not true. It's just a coincidence. Well, she took it to her daughter's neurologist, and her daughter's neurologist was like, yes, your daughter has a condition where she has water on the brain, and this increases her grand mal seizures. So he said, you know, the moon affects the tides. So because she has this abnormal buildup of water in her deep brain cavities, this is causing her seizures to happen. So there was a direct correlation. So if that can happen to this girl, why can't it affect human behavior? But you be the judge and you decide. So that is a little bit about the full moon phenomenon. Thank you so much for watching this video. Please check out my other videos and subscribe to this YouTube channel.